Hi, good afternoon everyone, dear friends and my colleagues. Myself, Dr. Selarka, Senior Consultant ENT Surgeon and Cochlear Implant Surgeon at Zydus Hospital, Ahmedabad. So today we are going to discuss on the hearing loss and the cochlear implant surgery. First of all, you have to understand that how our hearing works. The ear part, ear is divided in three parts, meaning the external auditory canal is a external canal, the middle ear and the inner ear. The middle ear, there are three ossicles. They are the smallest bone of our body. That is malleus, incus, and stapes. The inner ear, there is a cochlea and the semicircular canal, which maintains our hearing and our balance system. So first of all, we have to understand that how our hearing works. The hearing part, whenever the sound gets collected in the ear, it goes and vibrates the tympanic membrane. Due to the tympanic membrane vibration, there is a movement of the ossicles, and once the ossicle moves, there is a fluid in the inner ear that is called as an perilymph and endolymph fluid, which start vibrating, and it will lead to the electrical stimulation and the movements of the outer hair cells, which conveys the sound and process in the inner ear, and then it is transmitted to the brain, to the auditory cortex. So the sound which comes gets stratified in a frequency and loudness, and then it is transmitted to the brain through the inner ear and the cochlear nerve. Since we understand that how our hearing works, now what are the reasons for our hearing losses? There are congenital hearing loss. The hearing loss can be also because the rubella in the mother, which is very common in India. Measles. After birth, the child having the meningitis, pneumonia, jaundice can also lead to that hearing loss. Some of the cases where patient have a ototoxic drugs taken, maybe because of some disease like streptomycin or micacin or gentamicin, which now is very rarely used unless otherwise. This type of medicines can also lead to a hearing loss. Hearing loss is basically of two different types. One is a conductive hearing loss and one is a sensory hearing loss. Today we'll focus more on the sensory hearing loss. Sensory hearing loss, as we have discussed, because of the congenital, because of the ototoxic drugs, because of some meningitis infection, maybe because of many injections being given, can also lead to lack of hearing loss, or the sensory hearing loss. Now, once we understood what is the hearing, what are the diseases which can lead to the hearing loss, it is very important to say that also that nearly in India, there are 63 million people suffering from the hearing disability. Any type of a hearing disability, maybe a conductive, maybe a hearing loss, maybe in a mild, moderate, or severe form. 1 out of 1,000 children who are born suffer from the hearing loss. Once the hearing loss is diagnosed, how we can treat that? So there are different modality of treatment for the hearing loss, and each and every modality can be treated, and each and every type of hearing loss can be treated. That is 100% sure. Even if there is a disease in the ear, external auditory canal, there is some disease in the middle ear effusion, fungus, tympanic membrane proportion. There is some disease called as cholesteatoma, where all ossicles are eroded. Then also we can reconstruct that by putting an top or, and we can regain the hearing loss, that is a conductive hearing loss. In the sensory hearing loss, what we can do is there are two type of major modality are available. That is, one thing is an amplification of sound by a hearing aid, and second thing is by doing an cochlear implant surgery. So to understand what exactly is a hearing loss, how we diagnose that is very important. So first, to diagnose the hearing loss, we do behavioral assessment test. Behavioral assessment test in adult patient, they can be easily assessed and can diagnose the hearing loss. But in pediatric patient, they are very smart. Immediately, they, because of their visual acuity, they will divert the things, and then they can say that we can assume that his hearing is normal. But to have a complete idea of the hearing loss, we need to get an audiological assessment, that is a BERA, OE, and SSR. That is brain evoked response audiometry, optoacoustic emissions, and SSR. This we run a program where we even 1 day after birth we do a neonatal screening. That is a new way we can diagnose in the first day of the life that child is suffering from hearing loss or not. Once the VERA OE SSI is being done, we investigate that how is the inner ear anatomy of the children is there. If his anatomy is normal, then we can plan further according to the implant required, that is an cochlear implant surgery. So MRI is being done, that is MRI with brain, with inner ear, with oblique sagittal cut to see the internal auditory canal, and we can find out that how are the facial nerve, cochlear nerve, inferior vestibular nerve, and superior vestibular nerve. And the thickness of the nerve is again very much important to understand that after doing the surgery, is the patient is going to have good hearing, or is the cochlear nerve is intact or not. Once MRI and CT scan is done, CT scan also is very much needed, that is CT temporal bone, to understand that the anatomy of the cochlea. See, there are different type of deformity in the cochlea also. That is called as Mondinus deformity. Other type of deformities are there. To analyze that, we need a HRCT temporal bone, which is again very much important. Once CT scan, MRI is being done, and then the patient and the relatives, specifically if the child, we are dealing with the child, then the patient relatives, we discuss in detail regarding the type of hearing loss, the need of the surgery. Advisable to go with a bilateral hearing implant surgery. We can do also a unilateral hearing implant surgery, or because it is very costly, so we can plan for one implant surgery. Otherwise, it is advisable now that we go with both the ear implant surgery. So now basically what is actually a cochlear implant surgery? Cochlear implant surgery is with the help of a implant, we put it inside the electrode, we put it inside the cochlea, and then that whatever sound processor comes, say, just to give you an idea, there's a processor, to make it very simple, there's an internal device, there's an external device. So this implant goes inside the ear, and there is an electrode which goes inside the cochlea, and there is one electrode which is called as a ground electrode for the earthing purpose. This stays below the skin and above the skull bone. And there is an external device. There are two type of devices available nowadays. We have on the ear devices and off the ear devices, which is completely invisible, you can say. There is an off the ear devices available. Now, what exactly is being done is whenever the sound is perceived through this processor, it goes in the internal device through a magnet, and that analyzes the sound, distribute that particular sound in a different frequency and loudness, goes to the electrode and goes to the inner ear hair cells. Once it goes to the inner ear hair cells, then it will stimulate that particular hair cells, and then the sound will transmit to the brain. The ideal age of doing the surgery is less than 3 years. Because of our neural plasticity, which is the brain which acquired the sound, understand the language, is less than 3 years to 5 years. We recommend to do the surgery at the earliest. If the patient is old aged, then any age we can do the surgery. That is post-lingual hearing losses patient is having, then we can do surgery at any age. But if the patient is prelingual, then the recommendation is to do it earliest as possible. Now the sound which is being perceived transmit to this processor to the inner ear electrodes through the cochlear implant, and each and every hair cells which is being stimulating that particular hair cells, the upper hair cells, and that will be transferred to the brain, and then the brain perceives that sound, and the speech development happens. So to simplify it very simply, I can say that there is a factory, and there are 100 workers are there, and 100 workers, each and every worker is entitled to do one particular work. Each and every electrodes or each and every hair cells transmit that particular sound to the brain, which is analyzed in the brain, and then the perception and the speech language develops. Now, if that 20% of the people is not working, the load will increase on those 80% of the people. Same thing happens when there is a damage to that 20% of the hair cells, or the 40% of the hair cells, or the 60% of the hair cells, then 80% of the hair cells, then it will lead to a profound hearing loss. So the electrodes which we put inside the cochlea will stimulate that particular hair cells, and once that will start the stimulating, it will transmit to the brain. The particular sound will be reached to the brain, and then the person will start perceive the speech and language will be perceived, and then he will be able to have a good communication and the development of the skills of the speech language. Other investigation which is required is once the CT scan MRI is being done, then the important thing is required is the vaccination part. That is pneumococcal and meningococcal vaccines. Hepatitis B vaccine is being given prior to doing the surgery. And once everything is being done, we do the surgery post-oral incision with a very small incision which is kept behind the ear, nearly hardly centimeter, 2 centimeter incision is kept behind the ear. The temporal bone, the muscle bone is being drilled. We do a standard technique, there's a posterior tympanotomy technique. We put an electrode, insert the electrode in the cochlea, that is we put made a hole in the cochleostomy in the round window, and then we put the electrode inside. On table, once electrode is functioning or not, that we diagnose by doing NRT, then we close the wound. We take the stitches there, we close it. These are mostly the absorbable stitches, and we can say more of an which heals faster. The next day or day after 2 days, patient is discharged without we keep the master bandage with 1 or 2 days, and then we remove the master bandage. And after second day, patient is discharged. After 2 weeks, the patient is being followed up. We see that everything is healed and there is no any collection or any fluid or anything. Then after 2 or 3 weeks of the surgery, we plan to do a switch on, and that is very, very important. Switch on is being done, and once the switch on is being done, the electrodes are stimulated at the level of peak. The patient accepts that sound and then start learning this auditory verbal therapy. Again, it is very, very important and crucial step of the cochlear implant surgery. By that AVT, the maximum number of results are based on AVT. That is, you should have an in-house auditory verbal therapist, and a very good auditory verbal therapist. Once that is being done, we have to do mapping every 3 months so that we can increase the frequency and recommended this thing can be programmed according to the patient requirement. Now to the questions. How can we determine an infant as hearing problem? That is a really good question. That is, see, infants, even at the 7th month of pregnancy, we can determine the patient is having a hearing loss or not. So if the patient is having hearing loss, we do an otoacoustic emission that is being done on the very first day of life, and it gives confirmed idea that there is a universal screening program which also we run at Zydus, that the patient is having hearing loss or not. What makes the cochlear implant success or failure? Cochlear implant is completely dependent on the skill of the surgeon and the anatomical knowledge of the surgeon and the equipments available. And the most important thing is auditory verbal therapist. That plays the major role to develop the speech language of the child. What kind of the warranty comes with the device? Warranty, nearly all the implants which are available in the market as of now, they say that it is lifetime, and the inner implant is never to be changed. And as per my knowledge, there are very few cases where the implant has to be explanted only after some of the major infections. Otherwise, in a good hand, in a good theater and good surgical care, along with the aseptic precautions is being taken, then it is 100% there won't be any failure in implant. That is for sure. Does the cochlear implantation involve the brain surgery? It includes the inner ear surgery. There is another surgery called as a brainstem implant where the brain surgery is included. But otherwise, cochlear implant is an inner ear surgery, and it is not on the or in the brain surgery. It is over the skull one, or the if sometime needed, then we can drill the bone over the dura and we make the bone thin to put the but now the implant which are available is very thin implants available. So even now we don't need to do a bad. Sometimes we don't need, even most of the cases which I have done up till now, There are very few times where I need it because whatever implant we are using, they are the highest end implants. So they are the thinnest implant available in the world as of now. Yeah, what happens in the event of an accident or a health issue where the patient needs an MRI? Is the implant MRI proof? So yeah, MRI, if it is 1.5 Tesla in MRI is available, then it is the ideal MRI where we can do the MRI with the implant, but definitely we have to switch off the implant and then do the MRI. Is there a way to know about hearing ability of the baby while in womb? Can fetals can help? Yeah, so that's what I discussed, that at the 7 month of the month in the pregnancy, we can come to know that the child has some hearing loss or not. But generally we don't disclose because otherwise it's very difficult for the mother to pass to that 2 months with the child that his child or her child is not hearing, and then it is very difficult. Emotionally, it is difficult, and socially also difficult. So it's better to disclose only after the pregnancy, and on the very first day we can do otoacoustic emission, and then we can disclose the things. But the best part is that we can treat that any type of hearing loss. It may be a sensory neural, we can do by cochlear implant surgery. We can definitely give the benefit to the child. Is the hearing with the cochlear implant like normal hearing? Yes, absolutely. Those patients, see, as I said, like there are children who have a prelingual hearing loss, and there are adults who are postlingual hearing loss. In postlingual hearing loss, because they have heard a normal hearing, they know what the exactly speech language is there. When the implant is being the initial 3 months or 6 months, it may be difficult to adjust or to the sound, but the brain has a very good neural plasticity that can adjust to any type of changes. Like if you want to learn some other language, French or Swahili or any other language, then we understand it may take some time. Even I know Malayalam. So because I have been there and I understand that language, so our brain has very good cognitive function which we can understand, and then we can speak that language also. So same thing happens. Initially it may be a hindrance, but over a period of time, then the patient will have a very good hearing. And the prelingual child, since we call this a bionic ear, that is a electrical ear, where a patient will perceive that sound as a very first sound, and then it will be like a normal hearing for them. Only thing is that they have to understand the auditory verbal therapist. They will make them understand the language, which is very important, the speech and the words, which are very important. Yeah, so batteries of the implants are usually very expensive. Is there a way look for rechargeable batteries? Yeah, some of the companies they are working on it. They have multiple companies. They have a rechargeable batteries also. So mostly there is, and we are also in India. We are also working on an indigenous implant, which can be helpful. And we can bring down the cost of the implant. So that is also, it's a pioneer program by Abdul Kalam sir, and mostly it is still going on. What role should a pediatrician play if a family is pursuing implant for their child? So here it's a collective. See, whenever the child is diagnosed with an hearing impaired, the most important thing is they should consult the ENT surgeon, the pediatrician, the psychologist, the behavior psychologist, the audiologist, and the speech therapist. And the parent plays the major role. So it's a collaborative work of an all, like it's not only a person who has done the surgery and then that's it, it's over. No, it's not like that. It is a collaboration of the work of all the people, surrounding people of the child, of the person who is hearing impaired. And the very important thing is the pediatrician should guide them properly towards the center where there is availability of the cochlear implant, and then accordingly they can plan further. So unfortunate thing is that the hearing disability, which is very undermined, is not been taken knowledge of this disability after locomotor diseases. So it has to be taken very seriously, and all type of hearing loss can be treated. The best thing is that all type of hearing loss can be treated. Either can be a conductive or the neural deafness, sensorineural deafness. Conductive loss can be treated accordingly, the disease type, and the surgery can be performed accordingly, like a cholesterol surgery, which I discussed earlier. And in the sensorineural hearing loss, any type of sensorineural hearing loss, yeah, specifically speaking, if it is a meningitis patient and then he develops and he is being diagnosed earlier that he is having post-meningitis hearing loss, then we should go for an immediately surgery to prevent any ossification of that cochlea, which may make us hindrance in putting an electrode inside. So the earlier the intervention is, the better intervention. And I recommend that earliest age of doing surgery is the ideal age, maybe a 1 year, 2 years, or 3 years is the ideal age where the person or the parents should make their child undergo the surgery. That will help the child to develop as a normal child and in a normal school going children, with the normal school going children, rather than in a disabled school. They can be coming in the mainstream, and that can be a very worthwhile for the child. What is the life of a typical? What is there is a failure. Does the company cover the cost or resurgery and the implant? Cochlear implant, as I discussed earlier, that cochlear implants generally, if it is done in a aseptic precaution with a good surgical hand, with a good surgical team, and with a good associates, then in a good hands, it never fails. Company, if the implant is lost and damaged, then the company doesn't take the responsibility. But if there is any defect in the external device, then definitely they can take a call and they can help out. If after doing the surgery and there is an infection in the cochlear implant and if it has to be explanted, then mostly the company doesn't give any reimbursement. But if it is a manufacturing defect, then definitely they definitely help out. Yeah. The most important thing, yeah, it's a very good question. If it is a single implant or the bilateral implant, if you're asking me, I will suggest to go with a bilateral implant. Why God has given 2 eyes? Why God has given 2 ears? Why God has given 1 mouth? So listen more, see more, speak less. Same thing is whenever children is perceiving the sound, they perceive the sound from both the ears. Localization is very important. If the one implant is being done, the patient may have a good perception of the sound, but localization will be very difficult. Localization can be done effectively, and the synchronization with the environment can be done effectively when the patient is being implanted on both the ears. That is very, very important. How much the time does it take from family decide to undergo the surgery for the child if it is actually being performed? So what we recommend here is that once the child is being diagnosed with a hearing impaired sensory hearing loss, which is not being benefited with the hearing aid. So initially, if there is a mild or moderate hearing loss, definitely we advise for a hearing aid. It's an ideal thing to do. If the patient is having a severe to profound hearing loss, severe loss or severe to profound hearing loss or profound hearing loss, then we recommend to go for a cochlear implant surgery. We give a trial for 3 months for the hearing aid. They can take a trial. By the meantime, the child also will accept that something foreign body is there in the ear, and they will start accepting that. And after the implant surgery, if there is something is put on the ear, then they won't throw it away. So it is good that initially 3 months they will adjust to that particular hearing aid with the help of the cochlear implant putting on the hearing aid putting on the ear or the ear on the ear. What is the experience in performing this procedure? Is the patient from outside India? How long will they need to stay in India? Stay in the hospital outside and follow up, please, in detail. So recently we did a surgery patient who came down from Dar es Salaam. The patient was 1 year and 8-month-old child. Patient was profound hearing loss. They did a taken trial of the hearing aid. They did everything at their own place, and then ultimately they were referred to at Zydus. We investigate thoroughly again that how much hearing loss is having, the MRI, the CT scan, the pediatric, the neurologist opinion, the psychological opinion. We also rule out that he is not suffering from autism, autistic child. There's no any other disorders are there, neurological disorders is not there. Once everything is finalized, then we vaccinate the child. After vaccination, within a week or 10 days, we did the surgery. We did both the ear surgery at the same moment of time. Nearly we took 4.5 hours to complete the surgery. Both the ear surgery was being done within 4.5 hours. After the surgery, the bandage was being given, bilateral master bandage was being given, that was kept for 2 days. After 2 days, we removed the bandage. We saw there was no collection. We discharged the patient. Patient went to the nearby hotel. They stayed there. We followed after 14 days. We followed up with the child, and we on 20th day we started the switch on, and it was an excellent. The child started hearing from both the ear. On table also we confirmed that through NRT both the ear electrodes were functioning very well. And after switch on, we confirm it with the, and we maintain the required frequency which is required for that child. And then the speech therapy is started. They underwent the speech therapy for minimum 15 days, 2 weeks, and yesterday only they left for Dar es Salaam, back to Dar es Salaam. So in precise, we recommend that whenever a patient is planning from out of India, if they are planning to come down, they need to stay minimum 4 weeks, minimum 4 weeks. If they plan for a speech therapy or auditory verbal therapy after surgery, then it is recommended to stay 1 more month if possible. Otherwise, once they come down, 1 day to investigate and 1 or 2 days to investigate and finalize the things. And on the after vaccination, we can do the surgery maybe on the 5th or 6th day or 7th day. And after 2 weeks, we see out and we do the switch on. And on a month time, they can go back. Or else what they can do is they can come down, they can get the surgery done within 15 days, they can fly back and they can come again. That also can be done. Which vaccines are required prior to cochlear implant surgery? So as I already discussed, the hepatitis B vaccine, pneumococcal vaccine, meningococcal vaccine, which is recommended prior to doing a cochlear implant surgery. So we can just summarize that any type of hearing loss, specifically saying a neural deafness or sensory hearing loss, we can give any impaired person not benefited with the hearing aid, then we can plan for the cochlear implant surgery. Ideal thing to do cochlear implant surgery is to do on both the ear. If they cannot afford, they can plan for 1 year surgery. So at least the brain will start accepting that particular perception of the sound, and then the speech language development can happen. And the most important thing after surgery is the auditory verbal therapy. That is very, very important. And summarize, thank you very much.